Hello, my name's Professor Phyllis Butow and I'm from the University of Sydney. And today I'm going to be talking about managing fear of a disease coming back or getting worse. I'm going to be talking about how people experience these fears and how they can impact life, what makes fears worse, what can help, and some take-home messages. Now, after treatment ends for a serious disease like cancer or heart disease, people expect to feel relieved, triumphant, back to normal, but instead they can feel anxious, resentful, tired, or abandoned. And fear of the disease returning is a common cause of these negative feelings and can be very distressing. These fears are normal. After diagnosis of a serious disease, we may be left with a heightened risk of recurrence, even if very small, and we no longer feel bulletproof. If once diagnosed, why not again? Most people find it hard to live with that possibility. They worry, sometimes for years after the diagnosis, and family and friends worry too, sometimes more than the person who had the disease themselves. Now, this sort of worry can be mild and transient, where you occasionally think about the disease, especially when you have a follow-up test or appointment, or you get a symptom, or you might see a story about the disease. These fears usually quickly settle. But worry can be too intense, where you think about the disease often, perhaps every day. Any symptom makes you think the disease has come back. You might ask for lots of scans and tests for reassurance that the disease hasn't come back. You might avoid making plans for the future in case you need treatment. And you may feel exhausted from worrying all the time. And if this is you, you may need help. Now, you're more vulnerable to this severe level of worry if you've had a difficult path to diagnosis originally, if you've had extensive treatment with ongoing side effects that remind you constantly of the disease, if you've had negative experiences with that disease in others, perhaps you've lost someone close to you. If you've got young children and you're worried about being there for them, and if you've had other stresses and concerns such as a pre-existing anxiety or depression or financial worries. So worrying about the disease recurring is common, it's normal, but it can take over. And there's lots of research showing that you can reduce the impact of these fears. First of all, by getting information, finding out about the important signs and symptoms of the disease coming back so you don't have to worry about other ones. Find a GP that you can trust, and perhaps ask your doctor what the treatment options would be if the disease did come back. The reality is often better than fears. Another important skill is rethinking worry. Perhaps you put worry on a pedestal, thinking that if you worry all the time, you'll catch symptoms of recurrence early. And indeed, a little bit of worry is important, but worry can't actually prevent your disease coming back, and constant worry is exhausting. Or perhaps you fear worry, thinking that it will suppress your immune system and make you more vulnerable for the disease coming back. But in fact, there's been many studies on this issue, and there is no evidence that worry or stress increases the risk of recurrence. And pushing away worry can also be exhausting. It's important not to allow a small, potentially small risk or even a larger risk, which may never be realised, stop you from doing what matters to you in life. It's important to think about what is important to you and find a balance where you go towards what gives life pleasure and meaning. Make daily and monthly goals and take pleasure in achieving them. Another important skill is accepting worry but not getting caught up in it. Imagine a cat, and in your mind's eye, watch the cat. Does it move? Now, you know that is simply a thought in your mind. The cat will not leap out at you in reality. You can watch it and not react. This is a core skill of mindfulness, where you accept your thoughts. They're there, but you don't judge them or react to them or try to get rid of them. It's like watching clouds in the sky, and similarly, you can watch your fears without responding. It's also important not to try and suppress thoughts, but rather stay in the present. Think of a green elephant. If you try not to think of the elephant, it stays clear and sharp. But if you, for example, wrote down 10 things you can see around you or 5 things that you can hear, the green elephant fades away. So staying in the present can be helpful. And this is summarized by the word stop. Stop and bring your mind back to where you are. Take a breath and become aware of breathing. Open yourself to experience and proceed and reconnect with what you're doing. Another strategy is to schedule your worry to a time of the day, perhaps 10 to 15 minutes, and restrict your worry to that period. At other times, you can write things down for your worry period. At worry time, you can reflect on those issues, and if there is something constructive you can do, make a plan to deal with them. It's also useful to build on your resilience. This is not the first time you've managed uncertainty. Know your strengths and coping and what has worked for you in the past. If none of these things help, seek help. There are proven effective treatments for health anxiety and psychosocial health professionals like psychologists and social workers who can help. And a GP mental health care plan provides 20 psychology sessions for free. So the take-home messages of this module are to get information about your health. Don't put worry on a pedestal or push it away. Practice non-judgmental observation of worry. Bring yourself back to the present. Schedule worry. Plan to do things that give you meaning and pleasure. Reach out and seek help and enjoy life.